Hi guys. Today, as you already see in the title, we are doing a IV insertion video. I will be your lovely model. And we have a volunteer, somebody that's camera shy. My husband is going to be inserting an IV for this video in my hand, my left hand. A few people have been asking me to post videos about IV insertions. I'm going to be doing a full series about IV insertions, tips and tricks and different things like that. I have not put an IV in some time because I have not been working in a facilitated environment in over almost 3 years now. And with my job now, it does not require that. But don't worry, in the near future, I'm going to see if I still have it and post a video of myself doing an IV insertion as well. So let's get started. Babe, is there a reason why you chose this hand over this one?
Yep, there's a reason.
And what is that reason?
Because this hand, veins, although they are nice, they're not in the most optimal area to put the IV in because they're up here close by the bones, the bigger veins. Down by your bones, down here, they're a little thinner, and although I could get it, I don't want to risk it being infiltrated, or the vein blowing. So we would go with the safer hand, which is this hand, which has the bigger vein running right from the base of your hand all the way up.
Okay.
I'm going to apply the tourniquet. Now, for those that don't know anything about starting IVs, you put the tourniquet on because you want to force the vein to stop having blood flow so that it pumps up a little larger so that you'll be able to recognize it more when you're getting ready to put the IV in. Now, as you can see now, the vein is really starting to protrude a lot. So we're going to go ahead and clean the area. You're going to get your alcohol prep. And you're going to only wipe down. You're not going to wipe up and down. You're only going to wipe down. And then we're going to let that dry for a second. Now we're using in a regular Braun IV. This is the smallest gauge. This is a 24 gauge IV. All IVs are different. 24, 22, 20s, and 18s. You can tell the different gauges by the colors on the catheters. So this is yellow. So I know in any brand, if you see yellow, it's the smallest brand. That's the smallest gauge. That's the 24 gauge. Okay, so now we're going to put the IV right here. You guys can see this vein here that we're looking at. So we're going to ask the patient to hold their hand out. And don't be nervous. Now, we're not going to jab into the vein. We're going to go on a slight slant. And now you see where the catheter is pooling blood here. That means that we're inside of the vein. So now we're going to start to push forward and bag out of the site so that we're pulling the needle out. Once we pull the needle out, we want to apply pressure back here. Well, you say, why are we applying pressure back here once the needle is out? Because if you don't, then the blood will start to flow out all over the place. So you want to prevent a big mess. So once you pull it out, you want to apply some pressure here. You want to grab your tubing, which should already be
primed.
Yep. And we're going to apply this to that. Once we apply that, we're going to let the pressure go. We're going to tighten that up. Now, before we take this down, what we want to do is we want to check and make sure that there is blood return present. The reason you want to make sure that there's blood return present because if there's blood return present, then we are sure that we're in the vein. So before we tape it down, You want to clean your catheter, scrub the hub, they like to call it, and you want to do that for about 30 seconds. Once you scrub the hub, we're going to pause that, or you want to keep going?
No, just keep going, babe.
Okay. You're going to pull back, and you should see the blood coming back through the tubing. Now we know that we're in the vein. So we're going to leave that just like it is. And what we're going to do is we're going to secure it with the clear dressing that comes with the kit. Now, once we're secured in place, you want to flush it through again just to make sure that you're still in the same place, that it did not move. We're going to flush through, then we're going to pull back. Still have blood return. IV is successful. You flush it the rest of the way through, and we're done.
Alrighty. Thanks, guys, for watching. As always, like, comment, and subscribe. I will be posting more IV content in the near future. Actually, I'm going to try to post a video this week troubleshooting IV sites, and I'm going to make a video telling you my #1 thing that I think that all nurses should know when it comes to starting IVs. I'll chat with you guys really soon. This is According to Tawanda, Nursing, Lifestyle, and Budgeting. Like, comment, and subscribe. Thanks for stopping by.